Our next speaker is the Foundation Professor in Medical Informatics at Macquarie University. Professor Enrico Coiera is also the Director of the Centre for Health Informatics and the lead of the Australian Alliance for Artificial Intelligence in Health. He's medically qualified and has a PhD in Computer Science in Artificial Intelligence. Please welcome Enrico.
Thank you, Sophie. Well, I'm delighted to be here at the launch of the 2030 framework, which is bold and ambitious. And I'm going to be focusing very much on artificial intelligence today. So, about 1953, there was a brief one-page paper published in Nature, and I'm sure most of the people watching today know the names of these two authors, Watson and Crick. They went on to revolutionise the way we understood modern healthcare, human biology. What you probably don't know is that 10 years before that, two other scientists, McCulloch and Pitts, published this rather obscure-sounding paper, which in its own way is utterly revolutionary. So Watson and Crick, as you know, laid the foundations for modern genomics. What McCulloch and Pitts did was to discover that you could artificially create neurons mathematically and put together in networks. They could start to reason just as the way humans do, and they could compute. And so they had founded what now is artificial intelligence, and especially this very powerful form of AI called deep learning. And I like to think of these two as the two platform technologies that will underpin 21st century healthcare change. So while genomics has really had 20 to 30 years of amazing development, it's only in the last 5 years that AI really has started to take off, despite its very early start. So any of you who have a smartphone already have AI in your pocket. It runs the voice recognition on the system you use. It drives the Facebook and social media. It does your internet searches. It's already telling you what to think and what to do. The question really is, I guess, why in healthcare do we need AI at all? And it's because we're fairly limited as reasoners, human beings. We're not very fast in making decisions when they're complicated. We're very biased in the way we see the world and the decisions we come to. We're very bad at multitasking. Our memory, our short-term memory, which we use to remember what to do now, can carry about 5 or 6 items at best, which is not very much. We're easily distracted, as our mobile phones let us know every day. And what we can know as individuals is dwarfed by what is possible to be known. So that, of course, leads to delays, errors, and unfortunately sometimes patient harm. So how good is AI? Let's look at 4 standard tasks that we would think of as human tasks. And the first one is being able to look at a picture and pick an object out. You can see there the red line is human performance. And you can see already that AI is much better than us at looking at images and selecting features. It's what I call the Where's Wally task. When it comes to speech recognition, AI is now as good as humans at recognizing speech in single speech situations. Where it starts to struggle is when knowledge is involved. So answering complex questions can be difficult, and also being able to explain what's happening in images is still difficult. But this explains why AI is already, though, so powerful, and why, for example, AI is very, very useful in imaging tasks. So let's think about AI in healthcare, the sorts of things it might do in cancer care. So AI already has huge potential in screening, being able to eliminate many thousands of normals, so we can just focus on those images that might require further attention. AI is extremely powerful in diagnosis. It equals or surpasses human capabilities in diagnostic tasks. And as I mentioned, it's extremely effective on complex images. One of the areas where AI is starting to make real progress is in discovery of therapies. So being able to find existing drugs and repurpose them by looking at large cohorts of patients and seeing which patients were on those medications incidentally for other causes and did very well, say, for the other disease that you're interested in. AI is fantastic at looking at designs for molecules and coming up with suggestions for new drugs, and also for suggesting cocktails of drugs that we might not otherwise have thought about. One of the areas where I'm most excited about for AI is in the very basis of science. In other words, discovering new things. So being able to look at large data sets or electronic records, for example, not just looking at registry data, and identifying new subtypes or new populations that might respond to different treatments that we can approach very differently. I think AI-driven science is going to be quite revolutionary over the next 10 to 20 years. We often talk about AI, I guess, in a first world context, and I just want to remind us all that using AI and otherwise very simple technologies like smartphones with simple transducers can transform developing nation healthcare, and it's something I don't want any of us to forget. So just to summarise, AI and cancer, there are multiple touch points where we expect to see changes. Talk about screening, diagnosis, treatment, but also allowing people to navigate the health system itself through smart support. And it's no surprise then that in the framework that's launched today, the pillars 4 and 5 focus both on artificial intelligence and the necessary infrastructure, the data infrastructure behind it to make it happen. So what is happening in the space? You're familiar, no doubt, with the genomics mission in Australia, the Genomics Alliance and the Cancer Alliance. What is happening in AI? And so if you look globally, huge investments are happening. One I like to look at a lot is the English NHS, where they've invested about £250 million on an NHS AI laboratory to look at innovative ways of using AI across the system. And that investment is only part of a £1 billion investment in AI across the NHS, with ambitious goals around cancer care, for example, wanting to aim to save 22,000 lives a year by 2035. Lord Darzi did a major report for the NHS and showed that probably about 10% of costs across budget can be saved through smart automation like AI. And as we know, those savings can get reinvested in care. When we look to Australia, the situation is a little bit earlier. We do have a very strong and vibrant community, and I represent the Australian AI Alliance. About 95 organisations are involved in the AI Alliance, and our focus is very much on building the community, on developing work around safety and quality. I'm not sure why the slides have gone ahead, but we'll just carry on without it, guys. And we're very interested in looking at what it would mean to replicate that sort of English NHS effort in Australia. And so what we think needs to happen is something very much like the genomics mission. We need an Australian AI and healthcare mission. And for that mission, we need to not just focus on investment, very much we need to focus on regulation, safety and ethics for AI. These are very big issues, making sure AI does no harm. We need to make sure that we are focusing on workforce. So Australia's AI capabilities really rests in the hands of the people we train, and we still need to do that. But ultimately, we're going to need to invest in doing something substantial as imagined in the 2030 vision. So I would imagine that something like an AI mission would transform, we would hope, care in areas like cancer care. But also I'd like to see it invest in helping us as consumers and clinicians have smart access to the health system to help us navigate what is an incredibly complex system. And so looking forward, what will happen if we do these things? And these are things that we must do. I think we won't see a ton of AI in the next 2 to 3 years, but I guarantee that within a decade, it will be everywhere. People often talk about AI making us redundant, about losing jobs, but what's going to really happen is AI is going to transform the way we work as clinicians and healthcare workers and indeed as patients. So looking forward, I can imagine that we will see much of this 2030 vision come, hopefully in the time frame we imagine, and I think it'll be underpinned by 2 major pillars: genomics and the associated sciences around genomics, and artificial intelligence. Thank you very much.
Enrico. Thank you, Enrico. And if you have a question for Enrico, make sure to ask it in the chat because he's going to be part of our panel discussion in a little while.